When we talk about treatment in lung cancer, we have to face that we have made quite a development from an unselected treatment to a selected individualized treatment by the identification of certain targeted pathways that we may interact very specifically with certain drugs. We have now received a couple of information about potential oncogenic alterations in human cancers, and in particular in lung cancer. The problem is that we really need the transition to the clinical efficacy of targeted drugs. So we need randomized trials to prove the efficacy of these targeted agents compared to standard therapy. And this will be our task for the future. For lung cancer, we have now two pathways identified where we have drugs available, and these are the pathway of the EGF receptor mutated tumors as well as the pathway of the ALK translocated tumors. For these situations, we have very good drugs available, and these pathways really are key pathways, proliferation pathways for the tumor development. If we talk about our problems with identification of predictive markers for targeted therapies, we have to remember that we still do not have any predictive marker for anti-angiogenic treatment. We have seen a general improvement of efficacy by the addition of anti-angiogenic agent to cytotoxic chemotherapy, but still we do not have a predictive marker available. And this is something that we are desperately struggling for. When we consider future perspectives for targeted therapies and future goals of our work in treatment of lung cancer, there are two areas which might be of interest. One of them is the identification of drugs to overcome resistance to targeted therapies, like the treatment of patients who have been already pre-treated with tyrosine kinase inhibitors and now become progressive with their tumor disease. And the other area which is of great interest is the area of immune therapy, because up to now we do not have any predictive marker, and this is also a very important target or an important work to identify predictive markers for the use of immune therapeutic drugs. Other pathways also will become of interest. For example, we have seen interesting results for the MEK inhibition in patients with KRAS mutation that might become very important. We are now in the phase of the randomized phase 3 trials, or other pathways like the BRAF pathway might be of interest. We also have seen very interesting preliminary results for BRAF inhibitors in patients with BRAF mutations.